Hello, everybody. Thank you very much for being here. Before we begin, I'd like to call your attention to the blue press kits that we had available at the door. Inside those press kits, there were 2 items, frequently asked questions page about the current study that we're about to kick off today. Additionally, there's also a blank patient information form as well, so you can have the details on what the items are we're going to be looking for when it comes to this study. It's our goal to be as open, transparent, and thorough with this study as possible. That's why we're announcing it at this press conference and collecting data over a 3-month period and working with our partners and leading cancer researchers in the state. We are going to take a moment to recognize Commissioner Carol Whitmore from Manatee County, Commissioner, and also School Board Member Dr. Scott Hopes. Thank you very much. We also have Superintendent Diana Green and also Dr. Jennifer Bensi, who's the health officer for the Florida Department of Health in Manatee County. Dr. Green, if you would, please.
I think it's important for us to go over why is this study being conducted. In May of 2017, the school board and the county commission had a joint meeting to discuss the concerns about issues related around the old Bayshore High School. And at that time, it was asked of the health department to conduct a study of those who worked or attended the old Bayshore High School. As a school district, we are going to partner with the health department in looking at directory information and verifying was the person a student or an employee at Bayshore High School and what years did they attend Bayshore High School. On a personal note, as a mother of a child who was diagnosed with leukemia at the age of 2, I would also want to know, did the environment play a role in my child's health? And we need to be committed to this process to ensure that we can hopefully bring a resolution to this issue that has gone on for many, many years. Thank you.
Good afternoon. I'm Dr. Jennifer Bensi, the health officer for the Manatee, Florida Department of Health. Thank you all for being here today. Thank you, Commissioner Whitmore, Dr. Green, Dr. Hopes, for supporting this effort.
I can hear you.
Okay. As you are all aware, there have been many concerns brought to our attention about the health of the students, faculty, and staff who have attended Bayshore High School. We understand and completely agree that the health and well-being of those who attended the facility is an extremely important matter. While we have no evidence currently that Bayshore High School is the source of any disease clusters, we also understand the emotions surrounding this matter. Many environmental studies have been conducted by contractors working with the Manatee County School Board, Manatee County government, and others. The findings have not discovered any contaminants in the soil or groundwater which may have caused concern. At the direction of the Manatee County Board of County Commissioners and School Board, we at the Health Department have been asked to assist in the study of the students, faculty, and staff at Bayshore High School and their possible risk of exposure to a cancer-causing agent. To that end, our office will be collecting data on those who attended or worked at the school, have been diagnosed with cancer, and who wish to participate in the study. We will need from each individual the following. Number 1, a completed patient listing form, which includes a brief medical history of themselves or the person who was diagnosed with the cancer. Specifically, what type of cancer, approximate date of diagnosis, and name of hospital or doctor who diagnosed them. Secondly, the signature of the diagnosed or individual authorized to release the patient's information to the school system. And thirdly, a photo ID or a notarized copy of the patient listing form if a photo ID is not available. We will be working closely with the community group which has requested this study, as well as our partners in the media and the school board throughout this data collection process. The completed patient listing forms cannot be faxed or emailed to our office. They can either be hand-delivered or mailed to the address marked on the forms. We also anticipate having several days where we will be bringing the Department of Health mobile unit into the community where we can collect additional forms. We anticipate this process to occur through the end of February 2018. Once we collect the data, we will share it with the cancer registry staff, epidemiologists, and statisticians at the University of Miami and Florida Department of Health Florida Cancer Data System. This is a completely HIPAA-compliant process. After the data are analyzed, the final report will be returned to our office, where the findings will be shared with our partner agencies and made public. This process should take approximately 6 months following the data collection period. Again, we emphasize that we empathize with those who have health concerns about the students, faculty, and staff of Bayshore High School. That's why we are collecting these data, and we'll work with our partners and bring you the results by the fall of 2018. Thank you.
At this point, we would like to open up the floor to questions if there are any from the reporters. Yes, sir.
Yes, this is an issue that's been addressed for decades. What took so long to finally get to this point and start this study?
It was brought to our attention this year at the health department to assist from a medical data collection perspective of medical records.
Exactly what are you going to be looking at? It just sounds like you're collecting a bunch of paperwork, a bunch of their health records. I mean, can you be more specific of what exactly you'll be doing with all this information?
Right. We will be forwarding it to the state epidemiologist in Tallahassee, and they work with the University of Miami's Florida Cancer Registry System. So everyone who's had cancer in the state of Florida, been diagnosed with it, treated with it, is in this system. So we're going to compare the information that we receive locally with the data that has been in this system, and then determine the numbers to determine if there's a cancer cluster.
And this is all former students, former faculty, no one currently that is at the school.
Oh, no, it's from the beginning to currently, yes. Mm-hmm.
Now, if it comes up that the school isn't the source of it, will you guys be doing a similar study for maybe the surrounding neighborhood?
We can't speculate at this point. We're going to take one step at a time.
Do you know how much this study will cost for the health department?
We do not. We'll work with the state agency and with the university. It's something that we do in public health, so we won't be looking at that. The most important thing is really to focus on the results.
As you're looking at the data, how does age factor into your analysis? Because obviously people have gotten older as time's gone on.
And that's what the experts will be doing at the University of Miami through the cancer registry process.
Do you have any suggestions as to how we can get these packets to the relatives of the more than 400 people that have been affected by this situation? If they've moved out of state, if they've died?
Exactly. The information is available. It will be on the Department of Health Manatee's website, and I believe also the school board's website.
The school district will make sure we utilize all of our social media outlets, including our Facebook page, Twitter. We are transitioning to a new website, so we will not be able to put it on our website until that process has been completed. We also know that there are groups that have been working on this, and we will ensure that they have the information as well so that they can share it with other family members, other people who may no longer live in the state of Florida, yet they attended Bayshore High during a certain time period.
I know there's a lot of alumni groups online, things of that nature, people that put together reunions. Are you looking at maybe getting that information to them, to the way that you contact your alumni, just in general?
Yes, we will support the health department in ensuring that if information is given to us of here's 1969 alumni group, we will make sure they get that information as well.
Is 2 months enough to collect this data?
Well, we'll go through the end of February. If we decide at that time that we're still receiving quite a bit of information, we'll continue that process.
And I want to ask, I know he asked you and you touched on it. I mean, these are a group of people that I've spoken with that really feel frustrated, that they feel like they haven't been heard for years. And it just feels like nobody's listening. Can you talk to them? Because these are people that are living with this right now or have family members that have died.
And we definitely agree that we need to determine if there's a cancer cluster and if it was caused by their going to Bayshore High School. So we encourage everyone to please participate in this study. The more information we have, the more valid it's going to be.
Are there any plans for additional soil tests or anything like that in the room?
At this time, we've tested everything that was discussed in the joint meeting, and unless the school board initiates any additional testing, we've completed what we had agreed to do, which was test the wells that were still located on the Bayshore High School campus.
Doctor, I know that the Florida Department of Health said that this was the...
This doctor or this doctor?
You, doctor.
Which doctor are you speaking to?
You.
Oh.
There you go. No, I know that the Florida Department of Health mentioned that this is the first time this is brought up to them. I mean, I know that there's been soil testing and stuff of that nature done. Why is this the first time you're bringing in the Department of Health when this has been a concern for so many years?
Well, there's been a number of tests done this is probably the third time over the last 20 years that soil testing has been done at Bayshore High School. I've only been superintendent for 2 years. When it was brought to this board, they wanted a joint meeting with the county. In that joint meeting, they indicated that we needed to do this step. We met with state health department, we had experts come in, and this was a piece that had not been done, and this was sort of the missing link, and we need to do this, and I encourage everyone to please get this information out so that we can have a very valid study to, as I stated, get to a resolution about Bayshore, the old Bayshore High School.
Along with cancers, there's been a number of other reported cases such as like birth defects. Are there plans to kind of expand the scope of this study?
I believe at this time we're going to take one step at a time because it is a very complex issue to be able to do this type of epidemiology. So we will start with this since we've been told that cancer seems to be the most prevalent disease that we've been hearing about. And so we'll start there and see what the scientists find and the experts find for us, and we'll move forward from there.
So what I'm understanding is that you are going to put this on your website and give me the information to put it on the Bayshore, the Facebook page that I have. So are we relying only on social media to contact people? I mean, because in essence, if they don't see this information in time to get you the information, then you're not going to have enough information to do a valid study. It won't be a complete picture of everybody that went to school there.
Right. And we're hoping that all of you in this room can help us get the message out. And I believe that there may be other venues, opportunities through the school board to reach out to students as well, alumni perspective.
So is that a yes? Is that what we're going on at this point? Is just social media? I mean, there's not going to be any other attempt to reach?
Well, we'll have the packets available at the health department. We have some packets here today. And so we encourage if you can, to reach out to those from your classes. We encourage the media to assist us. The school system said they will be assisting us in trying to get information out to those who have graduated in the past. So it's a community effort. We look forward to other venues too. If you think there's some other way to reach them, we're open to that. The goal is to get as many people as possible who believe that they were affected through this mechanism, so that we can get to the bottom of it.
If any particular group, including Cheryl or my firm, my business, if we were willing to take the step to reach out to people, is it possible for us to get a list from the school board of every student for the past 30 years? And we could do a mass mailer or something like that?
I agree with that. I agree. That's the only way to reach out to us.
At least, we made the effort, and then if certain people respond or certain people never hear from us, at least we could say, we sent out a letter. I'll even do a follow-up letter, I don't care, but, and I have staff at my firm that'll facilitate it, I'll even pay for it. So, but I can't do it without names and addresses, so maybe we can somehow try to put together the names of the students of each, I don't know, maybe the graduating classes going back however many years, something like that. I think it makes sense.
Can I answer that question? What I need you to do is to do a simple public records request for directory information.
Okay.
That is what we are allowed to give, is just simple, publicly available information. 30 year, we have to be able to, we have to have those records. So I can't say for certain how far our records go back that aren't in a box somewhere, but everything that we have available, once you do that public records request, we can provide that information as directory.
We should reach out to whomever we already know and say, get us your yearbooks. Get us your yearbooks as far back as you have them.
Okay,
And that way we can at least cross-reference the names with names we get publicly from the school.
Okay, we have time for one more question.
Okay, Dr. Benson, so if we are not able to reach every person and you only get 15% of information, what kind of difference is that going to make on your data, on the study? Are you going to look at it immediately and say we don't have enough studies returned?
Again, we won't make that determination. The University of Miami and the cancer registry data scientists and epidemiologists will look at the numbers and determine that. But again, we're encouraging you. We've got to start somewhere. We want to see if there's something here. And we're going to start in February. Let's talk again and determine if we need to continue the outreach efforts or if we have enough information. But we depend on you to assist us in this partnership, please.
Dr. Benson?
This doesn't sound very scientific to me.
Well, again, we are collecting the data at the local level. It goes up to the state and then to the cancer registry, and they are the ones that will do
Well,
the
that's my point.
statistics.
It doesn't seem very scientific that you're just putting the burden on us. I would think if you don't have a strong database to begin with, what's going to be the result?
I think
Well,
the
this is what we'll do. I'll make, my law firm will make a public records request, as the doctor said we should. We'll see what their response is. We're also going to reach out privately to try to identify every student, and this includes employees and faculty as well. And we'll do our absolute best to get out in touch with people. The only thing that's going to hinder that is the response to the public records request. If it's, I have a feeling they're going to give us, they're going to respond properly to the public records request. The only other thing that would hinder it is that whether or not the school board has updated information for these people, which they probably don't. People move, people change, but the internet, you'd be surprised, I'm sure. We could do, I have a feeling we're going to get a pretty good response.
Dr. Benson, there are some people that attended the VOTEC, and for years, we have always included them, because that school was on the campus as well, and they shared water lines.
So if there are persons with cancer who attended, we would like that information, please.
Thank you.
Dr. Betsy, and the reason why we're doing this is to form a database. My former husband, my late husband, us went to that campus, but how are you, I remember when we were at our first meeting, the lady from the Cancer Institute said she needed to look at the histology, the pathologies. How are you going to be able to find that? I mean, when you want us to fill this out, just say what hospitals they were at and their physicians, and you can get copies of that so that the cancer place can do their data?
Correct. They're the ones
Okay.
that'll have the background information. And if we need additional information later, we will come back to you.
So that's important, that everybody fill these out as much information as they know, and if they have to attach something, so the Cancer Institute or whoever can get as much information as they need to be able to get the histology, the pathologies and all that. Correct?
Well, we believe the questions that are being asked on the initial form should suffice to get us to where we need to go in the first phase, if you will, to determine the numbers. And then if we need to get more specific from there, we can do that.
And me as somebody that had somebody that passed away, appreciate somebody taking the lead on this, so thank you.
Well, we all want to determine what's happened, and was it something related to Bayshore? Was it something else? Or was it naturally occurring? We need to make those determinations, and we have to have the facts to be able to move forward and have a conclusion for everyone, because I know it's been a long time coming. Thank you.
Great, thank you very much. Just so you know, I was informed by our IT department that the website is now available, that has the FAQ and the patient listing form, as well as a link to the Centers for Disease Control definition of what forms a cancer cluster, and and guidance from, I'm sorry, there was one more link I had on there as well. And there was some additional guidance on there as well. So please go to the Department of Health, Manatee County's homepage by the end of business today, and you'll see a link for Bayshore High School Health Concern. It'll take you to the website. Thank you very much for being here. Oh, sorry.
I do need to address about the public records request, because these are students, especially any present-day student, we would have to get their parents' approval. So there may be other steps that it's a little more complicated than just do the public records request.
Whatever the steps are, I know you have confidentiality
Yes.
concerns and things like that, so we can maybe work together to, if we can help in any way to achieve what, in other words, do I expect the school board to send out letters to everyone, or however you're gonna go about getting those approvals? We need to figure out how to do it. If my firm or we can assist in doing that to relieve the burden on the school board a little bit, tell us what we need to do. We'll submit the public records request and we'll wait for your response, and then we'll see how we have to proceed from there.
Thank you.